So my name is Colleen. I'm here in Vancouver. Thank you so much for inviting me to be part of this. It's an absolute honor. The highlight of my career has been working with folks with heart disease. And this morning I'm hoping to share what I have learned in my work with folks. All of my slides, as Jillian and Mark have said, will be available at the end of today. And so don't worry about writing down any of the content that I'm sharing. My goal today is to explain a bit about depression and anxiety and how it tends to show up with folks with heart failure and heart disease. To give you a couple of my very favorite strategies that work in the short term that you can start using today, and then also to show you some amazing references that are online that you can really dive in and read a lot more on if you'd like. So I've been able to work with folks with heart disease in larger cities, in both Calgary and Vancouver. I know that many of you have not had that opportunity, that there isn't a psychologist as part of your team. So I wanted to first go over how is psychology involved. Often there's a physician, there's a cardiologist, there's a pharmacist, maybe a kinesiologist, and many other members of the team, a dietitian. Where does psychology fit in? So if you could advance the screen 2 slides, please. Nope, back one. There we go. Okay, so what my job has been over the last, 16 years is to help people with heart disease and heart failure to manage stress and anxiety, to manage low mood and depression, and I'm going to talk about each of those in more detail next. Also, an important part of psychology on the team can be to help people make and maintain lifestyle changes. As you can read on the headline of any newspaper today, we don't like change. We don't like changing our life. We want to do what we want to do, how we want to do it. And needing to change that is very important with heart failure, and it's really hard for anybody to do. So psychology will have some strategies to help make that more palatable for folks, and to be able to not only make changes, but to stick with those changes. Also, there's an art and a science to building a support team. It really does take a village, and there are some specific strategies that I like to recommend folks to build their support team and keep that support team as you go through the process. Also, my job has been all along to help people with everything else going on in their life, because of course, as you're trying to manage with heart failure, you have the rest of your life to manage. You're falling in love, you're having heartbreak, you're parenting children, you're dealing with your boss, you're trying to get your job done. Real life is going on at the same time, and trying to integrate how to manage as best as you can with heart failure and how to continue on in the things that are important in your life is really important. So what I'm presenting today is an amalgamation of so much that I've been able to talk to about folks while playing in this role on the team. Okay, advance the slide, please. Okay, let's do a poll, and I'll check to see how many people are awake. Good morning. What percentage of Canadians will personally experience a mental illness in their lifetime? 5%, 10%, 15%, or 20%? Take a minute if you'd like to vote. I'm not seeing any responses. Craig, is there a way I can see the responses to the poll?
Hi, Colleen. Yeah, they're just coming in right now. I'll launch it in a second.
Perfect. Thank you. Oh, it comes up all at once. Okay, thanks. Oh, well done. Absolutely. 77% of you, 72 of you said 20%, and that's actually the case. So this question is asking about having an actual diagnosable mental illness, which is 1 in 5 Canadians. And of course, many of us can also have anxiety and depression that isn't severe enough to get that diagnosis, but is significant enough to affect our life and our well-being. Okay, next slide, please. This is one of my very favorite quotes. It's a columnist with the Globe and Mail, Andre Picard. And as he writes, "The mentally ill are not amongst us, they are us." It is absolutely old school to think of struggling with your mental health as something that, other people struggle with and crazy people have. Absolutely not. We now know that struggling with your mental health is as common as 1 in 5 people, if not more. It's certainly higher in many medical conditions, including cardiac disease. And I'm trying to give stigma a bad name, as they say. There's no space for that stigma. It is real. It matters. It makes a difference in people's life, and our job is to help people. Next slide, please. Okay, second poll. What percentage of Canadians will experience major depression at some time in their lives? Like to vote? 4%, 8%, or 12%? 12%. Yeah, it's actually 8%, but it's actually much higher in folks with heart disease and heart failure. But I absolutely applaud the sentiment that it is somewhere between 8 and 12%. That's 1 in 10 people. If you go to a mall, that's 10 out of 100 people. 10 out of 100 people. If you take 100 people with heart disease, it's very significantly higher than that. Okay, next slide, please. So why is it more difficult when you have heart disease? Of course, well, all of the other lifestyle changes that you're constantly reminded on a daily level to try to do are difficult for everybody. I work with many people who would rather not take any medication, and now you have this buffet of medications to take. You have to take them at various times during the day. And of course, your medical team might be frequently changing those medications, and most of them have side effects that you're trying to adjust to. That's really hard. Many folks are trying to change lifestyle habits that have helped them cope, such as smoking or decreasing their alcohol intake. That's really hard to do. Exercise, 2 out of 3 Canadians do not get enough exercise per week to meet Health Canada regulations. When you have heart disease, that's even harder. So of course, that's a daily struggle. Okay, next slide, please. And of course, as I mentioned, regular life. We're way too busy, we're way too stressed, we're not getting enough sleep. It's incredibly challenging and all-consuming to be raising children and watching grandchildren. And of course, just regular getting sick, having a cold, breaking your leg, having this pain in your hips. You often don't just have heart disease, you have regular life unfolding at the same time, and it's a lot to take on. Next slide, please. In my job, one of the true highlights of my career is the understanding that for every single person, heart failure unfolds in the context of their life and their values. It means something different to everyone, and this has been an absolute gift of my life. For example, people have told me, next point, please, next click. If I can't provide for my family, what good am I as a man anymore? So if your heart failure affects your ability to earn a living and provide for your family, that can fundamentally cut to people's sense of identity, their value, and their worth. Next point. I don't have time to take care of myself. I'm taking care of everybody else. I'm completely overwhelmed. The vast majority of people referred to cardiac rehabilitation don't go. The number one reason people say that they don't go is they just don't have time. They have too much on the go. Next slide. Next point. It can be so unfair. I did everything right all along. I followed all the rules. I behaved myself. I was a health nut. And now I get this. It's unfair and it's awful and I'm frustrated and resentful. Of course. Next point. There can be a ton of regret and fear and shame. You lived your life as a normal person and had habits that regular people have, and you were one of the unlucky ones that it caught up with you. And something like smoking may have had a devastating impact on your body, and you may now have a devastating disease. And the amount of frustration and shame and regret I hear about over that is heartbreaking. Next point, please. I've met many people who say that throughout most of their life, they would pretty much take an aspirin at most if they were in excruciating pain. And now they have 6 medications they're supposed to be taking regularly. Taking medications for many people can mean that, quote, I'm a sick person, that I'm somehow less capable, less worthy, or that I'm weak. And yet the reality is taking your medications reliably is paramount to living with heart failure. It can be a really bitter pill to swallow, no pun intended. Next point. And as I said, it's totally unfair. Now I have to think about my mortality. Now I can't go out. Now I need to restrict my activities. Now I can't do the sports that I used to do. The costs and the losses that come with having heart disease and heart failure can be absolutely devastating. All right, next slide. If you're feeling alone, if you're feeling stressed, if you're feeling overwhelmed, you're in very, very, very good company. Next slide, please. The impact of depression on cardiac health is real. Certain behaviors in people with depression contribute to the development of heart disease. Of course, smoking, a poor diet, which is incredibly common, low exercise levels, which is the norm, incredibly common to struggle to get enough exercise, social isolation, chronic stress, that contributes to heart disease, and then having heart disease contributes to depression. Next slide, please. What we know from research is that people with depression and anxiety do not follow their medication regimen as accurately as others, which again can then have an impact on your heart disease and on your quality of life. Next point. And we know that people with depression are 3 times more likely not to follow their medical treatment advice. It's too hard to find the motivation, etc. So it can be, it's adding insult to injury, so to speak. Next slide. Let's keep moving. Next slide. I've talked about those. Okay, so the 4 key messages I want you to take from this morning is that depression and anxiety are real. I have a funny job. Everything I talk about really is invisible. Sometimes I wish I could take your blood, a sample of your blood, and show you a number and say, see, you have anxiety, it's real. And yet it's as real as the screen in front of my face. It's just very hard to see, but the impact is significant and it matters. Also, depression and anxiety affect people in different ways. So for instance, the classic thing you might think of with depression is this profound sadness and crying and weepiness. But for other folks, depression can look like flatness and not being motivated. Depression and anxiety are treatable. Please, if you remember one thing from my presentation this morning, please have it be this point, that depression and anxiety are treatable. You can talk to your family doctor about a resource you can access. You can access some pretty terrific resources online. There are distress centers and help centers you can call into. Please don't give up. Depression and anxiety absolutely are treatable. And if you have depression and anxiety, you're not alone. You're in very, very good company, and you have it for good reason, for a myriad of reasons. Next slide, please. So what do you do? What do you do when yourself or your loved one are struggling with depression or anxiety? Well, here's a bit of what not to do. Never tell someone the days of just pull up your bootstraps, just get over it. At least you don't have it as bad as other people. That is not helpful. As this is from the internet, never in the history of calming down has anyone ever calmed down by being told to calm down. I would add to that, never in the history of cheering up has anyone ever cheered up by being told to just cheer up. Next slide. So what do you do? And this is when we get into some of my very, very favorite strategies. So this is the fight or flight response. I'm going to talk, this applies to both depression and anxiety, and you can start thinking about it today as you work towards other skills for managing your mood. Think of adrenaline as a very powerful hormone in your body that is released when your brain perceives a threat. Now, from an evolutionary perspective, it's in our DNA. It helped us survive. It made us bigger, stronger, faster, so we could fight off a threat. There are very strong physiological changes. Think of the stories that at the end of the Super Bowl, and the player takes off his gloves and realizes he's been playing with broken fingers. He didn't feel it because of the adrenaline, or the moms that lift the cars because a baby is trapped. You literally become bigger, stronger, and faster. So think of, 1, 2, 3 is in that zone where you're pretty calm, you're going about your day, things feel pretty good, and you're just heading out the door for a walk. 4, 5, 6, 7, Your brain has perceived a threat and you're a bit on, I call it like lifeguard mode, where you're a bit vigilant. Something feels a bit off, you're not sure what's going on, and you're starting to pay attention, and your mind is quite focused or is going blank because your adrenaline has kicked in. And then 8, 9, and 10, I think of the panic zone. When you're in that zone, your only job is to stay safe. If you're driving, that might mean pulling over. If you are writing an email to your boss and the entire company because you're incensed with something, don't hit send. That's how you keep yourself safe. Hit draft and reread it later. So this stress response is something I think about daily. I teach it every single week for 20 years. And starting to tune into it today will help you manage stress, anxiety, and depression. Next point, please. As our stress level goes up, so think about going from that 3 to that 8. It's in our DNA that there are dramatic changes because we're fighting off a saber-toothed tiger in our body. So you might get hot, you might get cold, you might get all sweaty or get pale. Your blood pressure goes up. Your heart rate goes up. Your breathing often becomes more shallow and more rapid. Your emotions change. So around 3, you might be feeling just fine. And at 8, you might be feeling panic-stricken, enraged, humiliated, full of shame, etc., etc. Your behaviors also significantly change. If you compare where you're at with a 3 versus 8, your behavior probably looks quite different. As I described that, if you're in an airport and you watch somebody who's missed their flight, who's extremely upset, you see that 8, 9, and 10 very clearly. And our thoughts, which is a huge part of psychology. Our thoughts at a 3 are completely different than our thoughts at an 8. And I'll talk about next how that can really contribute to feeling pretty awful. So next point, please. What we know from research is that as you go up this fight or flight scale, in order to survive, there was great evolutionary value in being vigilant and paranoid and cynical and negative. If we thought, a million years ago, if we thought we heard something in the woods, we were more likely to survive if we took that seriously and doubled down and stayed up all night and were vigilant. And it goes from, I think there's a threat to, I know there's a threat. So we know that our thoughts, as you go up that scale, become more extreme, more rigid, more negative, and here's the kicker, we become more confident that our thoughts are more accurate, even though they're not. I think of this a lot when I hear terrible stories about road rage, barroom brawls, right? So if someone takes your parking spot at a 3, you might be thinking, oh, that's really annoying. I don't like when that happens. But let's say you're nervous about your doctor's appointment. You're trying to find your parking spot, somebody steals your spot, your adrenaline's at an 8 already, your thoughts are more likely to be, I hate that guy, I know he did it on purpose, I'm gonna get back at him. Okay, next slide, please. Okay, this is the second graphic that I draw every week in my practice forever. And this is essentially the human experience summed up in 4 words. I think there's more to the human experience. For some folks, that might include spirituality, for instance. But from a psychological perspective, this model really helps us understand how we have an experience and how sometimes that can get us into trouble. So I'll use the example, as some of you know, my dog is in my dining room here with me. If a big dog goes by outside the window, he's going to start howling. There's not a lot I can do about that. So let's say that were to happen. I would have thoughts about that. I would have a physiological reaction to that, which was the earlier slide talking about, I get sweaty, my heart would start pounding. My behavior is I would become apologetic and I'd be a bit flustered, and my emotions are I'd be embarrassed and probably giggly is how I would react. And so all 4 aspects of ourselves strongly affect the other aspect. Think if you got a call today from your physician's office saying that they're going to change one of your medications again. You would likely have thoughts about that. Those thoughts, you see all of those arrows are double-sided. If you were to think, oh, good, I'm glad they're on top of it, that's really helpful to know that they double-checked it. If you were to have that thought, Your emotions might be something like relief. Your behavior might be something like you'll call right back and make an appointment for next week. And physiological response might be, 3 or 4. Okay, it's another thing to juggle, but I'm on top of it. But let's say your physician's office called and said, oh, sorry, we got to change the dosage of one of those medications. And your thoughts were, oh my God, like, why am I even bothering? This is ridiculous. I can't do this anymore. What's the point? I can't do this. It's stupid. If those are your thoughts, can you see how the emotions those thoughts would generate are likely very different than, relief and determination? They'd be more likely emotions like resentment, frustration, rage, as random examples. And those feelings, note the double-sided arrow, can then drive more extreme thoughts like, I hate this doctor's incompetent, I can't do this anymore, this is stupid. Those thoughts then might drive behaviors like, forget it, I'm not calling back this week, I'll deal with it in May because this is just too much. And the whole time your physiology is responding to those strong reactions and getting more extreme and more dramatic. This is the most elegant engine anyone could design, where it's designed to rev up, so that once your physiology changes and you have that fight or flight response, everything you think and feel and do, everything you're tempted to think and feel and do, has it revving up even further. So the next thing you know, you might be too overwhelmed to call your doctor's office back. You might be screaming at a nurse and then hating yourself for it. You might be behaving in a way this weekend that is destructive and leaves you feeling terrible next week. Okay, next slide, please. Aha, same slide, different title. This is also a map of how we get out of trouble. Almost all psychology skills are about using that same relationship, but to your advantage. So rather than have those relationships between different parts of yourself work against you, changing them more so that they work for you. Let's jump right in on those. So next slide, please. Okay, so one of my favorite techniques, and we're going to do one next, is a relaxation technique to help bring that red arrow back down. So I'm curious what you think. Everyone's heard of yoga. Everyone's heard of meditation now. It's a big deal. When I grew up, it was the meditation retreats out of California and having pet rocks and mantras. Those techniques are still around. So my poll is relaxation techniques such as deep breathing. They're a nice distraction and they feel good, but they don't actually change your body's physiology, right? There's no actual physical benefit. They just calm you down a bit. Do you think that's true or false? Oh, I missed. False. Oh, nicely done. Okay. So those of you who said true, you are actually mistaken. Then my next slide is one of my favorite slides. If you could advance it, please. Here's what we know. We know that people who frequently practice active relaxation techniques, and I'm going to talk about what that means in a second. What we know from research is that they become more acutely aware of their stress and tension level. They're better able, they're more accurate, more precise at that red arrow from 1 to 10. They are more accurate and precise at gauging where their current stress level is, that tension level. They're more aware of when their stress is rising, which is amazing. Three-quarters of psychology is about prevention. And if you know when it's starting to rise, you can make different choices to help bring it back down. Number 3, people who regularly practice active relaxation techniques are more effective at lowering their tension level. And this is a really big deal in psychology. You actually do have a lower physical general resting tension level. So let's say during exam week or the week you get your job performance, rather than walking around at like an 8 out of 10 with doing nothing else but regularly practicing active relaxation techniques, maybe now you're walking around at a 6.5. instead of an 8.5. That's fantastic. Remember that blue model with the 4 circles. If you can bring down that physiological response, it helps you moderate your thoughts, it helps you moderate your behavior, and it helps your emotions feel more manageable. So 2 things I want to say on this slide. One is that this is not crashing in front of the TV and watching Netflix. So passive relaxation techniques, yeah, there's some benefit. Binge watching a great show, you're lying down, you're relaxing, you're distracting yourself, you're being entertained. Those are all good things. Keep doing those things. I often Google comedy shows. It's a great way to unwind. This research is based on active relaxation techniques, and the goal is to find one that works for you. These days on the web, there are tons. Some of the resources I'm going to provide on this slide set will also include other ones. So what's my point? My point is to find an active relaxation technique that works for you. You're actually activating what's called your parasympathetic nervous system, which is the part of your nervous system focused on your calming response instead of your arousal response. Whether that's a breathing technique, a visualization technique, progressive muscle relaxation technique, meditation, Tai Chi, Qigong, those are very active techniques that are based on actively calming your physiological arousal level. Also, I want to mention that you get better at this the more briefly and frequently you practice it. So you do not need to spend every Tuesday and Thursday night practicing your breathing for 3 weeks, or for 3 hours for 3 weeks. I want you to think about your breath frequently, many times a day, as often. You can't overdo this. It's an amazing investment for free with great payoff. And you're meant to practice this when you're just going through your regular life, so that eventually, when it's a skill that you're more adept at, you can access that skill when you're getting stressed out or your mood is starting to drop. So let's practice one now. If you could flip to the next slide, please. This is one of a million different relaxation techniques. If you Google it or you look at the resources that are on my slides at the end, you'll see other examples. Remember, the point is to find one that works for you. I'm a counter, so I like this one, and usually keeping it as simple as possible is really important. So everybody settle in your chair, put both feet on the ground, get as comfortable as you can. And I'd like you to count the beats without changing your breath first. Count the beats of your breath in. As they say, we all beat to different drummers, so I'm not doing the beats. Just with each breath in, count the length of that breath by beats. I'll give you a moment to do that. Try not to change your breath yet. Just breathe as you were. Already my shoulders are coming back down from being planted beside my ears. Okay, next point, please. Now, try to count the beats of your breath out. For example, you may notice that the length of your breath in was 3, and the length of your breath out was 5. I'm making that up. I think that works for me, but whatever works for you, whatever you're noticing in your breath. So my regular breath as I sit here and talk and try to explain myself has been about 3 in and 5 out. The next step, next point please, is to try to shift your breath to make these equal. So the length of your breath in becomes equal to the length of your breath out. So for example, a beat of 4 in and a beat of 4 out. And the last point, please. Now, if you can, try to lengthen the beats in and out. So for instance, if you were doing 4 beats in and 4 beats out, now try to do 5 beats out, 5 in and 5 out, maybe even 6 in and 6 out. Now, there are no bonus points for going to 17. You're not meant to strain or hold your breath. You're meant to try to slow it down and lengthen it. So this is one, as I said, of a myriad of relaxation techniques that help you manage that red arrow, which helps you manage that blue circle of physiology. Don't expect to notice the benefits of this anytime soon. It takes a couple of weeks of actively practicing this, but think of doing it when you're brushing your teeth, when you're brushing your hair, when you're having a shower, when you're doing the dishes. You're trying to fit this in frequently and often so that it becomes more habitual for you. Okay, next slide, please. This is a huge topic in psychology. It's the majority of what's called cognitive behavioral psychology, is to work on changing your thoughts. There are really three pillars of addressing anxiety and depression from a psychology perspective. One is learning to calm your body and mind. We've talked about that. The second is learning to identify, catch, and change problematic thinking patterns. The examples on the screen here, it's gone around on social media, are examples of ways that people are working on changing their thoughts around COVID. Imagine with heart failure, imagine that you're a perfectionist and your thoughts tend to be quite perfectionistic. Well, it's not that your thoughts have caused your depression or your heart disease, and it's not nearly as simple as, oh, just change how you think about it, or at least you don't have such and such. It's that sometimes all we do have control over is our thoughts. We're in a crappy situation with few options. Changing how you think about a situation can help it be more bearable and can help us manage our mood and our anxiety. I won't go through those now. There's tons of talk of COVID. There are countless COVID coping strategies on the internet right now at credible sources. But I did want to make this slide in the resource I'm going to recommend next, have all sorts of activities for managing your thinking around your heart disease in your life to help you manage anxiety and depression more effectively. So I said there are three pillars. One is calming your body and mind. The second pillar is learning to catch problematic thinking patterns and adjust them so that your thoughts can work for you more often instead of against you. And then the third is behaving in certain ways, doing things to help you keep moving forward, goal setting, problem solving, experimenting with making new changes are all helpful with anxiety and depression. Okay, next slide, please. And I'm going to briefly make a point about support. It really does take a village. There is an art and a science to having support and a support team. Fortunately, with the internet, we can reach each other as we are this morning across Canada. Sometimes people feel much more comfortable on the internet because there's a bit of anonymity. It doesn't feel like everybody's going to know your business. So I really encourage you to check out the online support resources to connect with a community that helps you feel seen and heard and that your problems are normal and understood. Next slide, please. This is stealing from one of my favorite books. It's dated now. Please don't trust the medication information at the back because it's a 20-year-old book, but it's written by a psychologist named Wayne Sotil, and I love this book in every other way in terms of coping. And he talks about one of the really important things with getting and keeping a support team is making a list of what needs to be done. Be as behavioral as possible. Often people say, you know, honey, I'm really struggling and I need you to be more supportive. And the other person says, okay, sure. But they don't actually know what that means. Does that mean going to get you medications? Does that mean helping you fill out the, COVID emergency fund? Does that mean making you laugh and distracting you and taking your mind off things? So think about what you need from a what behavior perspective, very specific perspective, and then try to match those things on your list to different people's personalities and abilities. So your best friend might be great at making you laugh and distracting you, but might be terribly judgy about what you're eating or your exercise level. So don't ask them for your support around your exercise and your eating. Use them to help make you laugh on Friday nights, for instance. It's a marathon, not a sprint, as you all know very well. Being able to pace yourselves and your support team, and of course, getting backup for your backup. One person cannot do it all. Next slide. Okay, I'm just going to mention these quickly because I want to make sure there's time for questions. There are 3 resources that I love that are online. They go into far more depth of what I talked about here. They're all free, and I've included the websites on the slides so you can track them down. This is an oldie but a goodie. Positive Coping with Health Conditions, a self-care workbook. Next slide, please. I know this is tiny, but I couldn't figure out how else to do it. So up in the top left, You see the website address to find this, or you can just Google it. Google positive coping with health conditions. You can Google the authors if you like, they're there, and look at the topics: relaxation, managing worry, activating your life, some of those behavior changes I talked about, solving problems, managing depressive thinking, which I also alluded to, managing anger and relationship building. Also on the very bottom, you see that they include a relaxation audio. Maybe you prefer that to the counting technique I taught you. As I said, there are countless different techniques. What's important to find one that works for you, and there's another one included at that webpage. Okay, next slide, please. And we're on our last 2 slides. I love this resource as well. You see the webpage for it in the top left, the Antidepressant Skills Workbook. I want to point out a couple of things. As you can see, I'm pointing, you can't see my finger. If you want to download this workbook, it's available in English, French, 2 versions of Chinese, Punjabi, Farsi, and Vietnamese, which is fantastic. Also though, reading's not for everybody. You can download this workbook and listen to it on audio, unfortunately only in English currently, and you can download it, it's in blue down below, all at once as one big file, or in individual chapters if you find that overwhelming. And you see again, the topics include what we've touched on today. So reactivating your life, those behavior changes, realistic thinking, I mentioned that's really core to helping you manage depression and anxiety and stress, effective problem solving, and then I got cut off on the bottom, but also relapse prevention, how to stick with the positive changes you are making. Okay, and 1 second last slide, please. I love this resource. Please don't let it overwhelm you. I just couldn't not include it. Australia has a similar challenge to Canada, where there's a whole lot of people, sorry, not a lot of people spread over a vast area. So they've put beautiful mental health resources online. This is the Center for Clinical Interventions, looking after yourself. And you see that long list of items in blue. For each of those, they have a workbook and worksheets that you can print up and work on. And topics include things that might be relevant to helping you manage your heart disease or your loved one with heart disease. Perfectionism, procrastination, self-compassion, tolerating distress, sleep, worry and rumination. We all need help with those, myself included. Those resources are fantastic. They're all free. You can also download them by chunk so you don't get overwhelmed. Please feel free to use those. I think they're just beautifully done. Okay, and last slide, please. I wanted to thank you. It's an honor to meet you and work with you and to be asked to participate. I put in a picture of my adorable dog because I thought I might be apologizing at this point because he might have howled through the whole thing. Fortunately, he did not. And have a wonderful day. Thank you for involving me in this event. And I'm happy to take any questions if you have them.
Great. Thank you so much, Colleen. It's really wonderful. You've got some just incredible insights and a vast amount of experience. Craig, can we just go back to the last slide just for a minute? Thank you. So we do have a few questions that have come in. And so they're madly coming in now, which is wonderful. So, not madly, I should say.
Coming in
they are coming in.
I'll do my breathing.
Thank you. So first, one of our participants says, when elevated stress morphs into distress, what do we do? What can we do when this happens, when we find ourselves, whatever time of day it is?
Great question. Great question. My first answer is a bit annoying, that people get better at managing distress the earlier you can catch it. If you think of that red arrow again, once you're up into the 8, 9, 10, it's hard to use skills to bring that back down again, because you're panicking, right? So ideally working towards being able to lower your distress before you get into that zone is the golden ticket if you can. That happens with practice. And so the better you are at starting to recognize when you're going 5, 6, 7, 8 and making changes in that zone. Think of it as stoplights, right? So below 5 would be green, 5 to 8 would be kind of orangey, and then 8 to 10 would be the red zone. You're trying to catch it in that mid-range. So when you're noticing that it's building and building, that's when all sorts of tools like removing yourself from the situation, stepping away. I said, you have my full permission to stall. If you're in a meeting and it's not going well, and you're getting all sweaty like I would, and knowing that this isn't going well, I would say, I need to use the bathroom, or I'll need to get back on you. You stay safe, you don't commit, and you rein it in. Because remember those four, the model of blue with the 4 circles, once you know that you're distressed, your perception is off, which makes it harder to hear and makes it much harder to present yourself in the most effective way that you'd like to. There was Bob Ray, the politician, his quote used to be, "You can't be smart and mad at the same time." So when you know you're losing it, stall, walk away, back away from the email, get out of the meeting. Maybe if you're in a doctor's appointment, saying, can I write some of this down? Could I record your advice? Could I make a second appointment? Because I'm afraid I didn't hear much of what you were telling me today. I was too upset. So really, awareness is critical. And then over the longer term, working on those relaxation techniques so that you're better able to recognize when you're getting upset and take steps to try to stay out of that red zone. If that makes sense. It's a lot. It's a great question.
Yeah, absolutely. We also have one similar to that, actually. Somebody just asked that they sometimes get anxious at night and they live on their own. So what can they do to stay calm?
And did you know that anxiety is more typical at night? It's a huge generalization, but often folks with depression feel worse in the morning. Everything that's facing them that day feels unappealing and overwhelming. And folks with anxiety tend to feel more anxious at night. You might feel vulnerable being alone. There can also be that sense of, oh no, I have all this stuff I didn't get done today, and now I have to get it done tomorrow. First off, the fact that you know that that's a more vulnerable time for you is really insightful and helpful. I would, thinking of those 4 blue circles, I would do behaviors that are calming and soothing and loving. So having those nighttime routines that reassure you that you're safe are really helpful. So whatever those routines are for you that you find comforting, we do it with kids all the time, right? There's a structure, reassurance to that routine. You could also talk to, if there's a social worker or a nurse or somebody you're working with on your health team who could help you make sure that you've done a bit of a checklist to keep yourself safe that night. Do you have a phone nearby? Do you have a list of your medications so you're not relying on your memory when you're stressed or anxious at night? I would have an actual checklist of what to do at night, so that rather than try to remember what to do at night, which is hard to do when you're anxious, you can go through that checklist and reassure yourself that you are physically safe. Now it's time to take care of the emotional sense of being unsafe, if that makes sense. Don't go easy on your brain. Your brain is nervous and anxious and overwhelmed at night. Have a list and a routine to follow to take care of yourself. And I would load it on like you're an 8-year-old having nightmares. Be loving, be kind, be compassionate, put on your favorite pajamas, listen to your favorite music, 100%.
So Colleen, now this kind of leads into the next question from a participant. How do we support our caregivers as patients?
That's a fabulous. First off, thank you for thinking of that. It really does take a village, and that's wonderful to thinking of it. I would have a very open conversation about what's working and what's not working, specifically behaviorally, and I would talk about it being a marathon, not a sprint. And I would find a way for your caregivers to have, on the third point, some sort of space to themselves, even if that's an hour a day when they can cry, go for a walk, stretch, listen to loud rock music, whatever works for them. They definitely need a zone to themselves. And I would have a very direct conversation about here are the things I need. What do you like to do? What do you not like to do? Not expecting them to be able to do everything. So maybe the person would say, I love going with you to your doctor's appointment because I can write down notes and I feel like I'm doing something and I'm listening to the experts and I'm really good at that, but I don't want to cook for you. It stresses me out. I don't enjoy that. Can we make another plan around the cooking?
Mhm.
Often we assume that our care providers, well, they just have to do everything because you're stumped, but that's not sustainable. So work on what do they like to do, what are they good at, and build at that, and make a plan around. Maybe this is the time. I know with COVID, I say this with all sensitivity, but maybe online shopping is an option. Maybe hiring someone to do the yard work is an option. Maybe having somebody help with anything, maybe there's a 17-year-old in your life who would love to drive you to appointments. You wouldn't count on them for anything else, but they would love to drive you around to appointments. And that doesn't need to be your spouse who's exhausted, and doesn't need to be your driver dealing with traffic and parking.
Yeah. Thank you.
You're
Wonderful.
welcome.
Thank you so much, Colleen.